Hello people, in this video we want to look at erythema nodosum. Basically in the exam they'll ask you the causes, okay. So basically you write standard things, okay, some bacterial infection like streptococcus, etc. Maybe tuberculosis, right, some virus, fungus, and some drugs can cause erythema nodosum like sulfonamide, sulfonylureas, oral contraceptive pills, systemic diseases, do not forget sarcoidosis, inflammatory bowel disease, malignancy, pregnancy. So there are so many conditions in which you can see erythema nodosum, okay. Even Behçet's disease, which is vasculitis, you can see erythema nodosum. So basically here you can see this image of erythema nodosum. Basically it is bilateral kind of a condition, right? Erythema is red and nodule kind of a thing, right? So look at the more details on this. So basically this is a skin condition, and here what will be there, the technical thing you will say is there will be septal paniculitis of subcutaneous fat. This is what you have to write. Okay, what is it? It is paniculitis of subcutaneous fat. And what type of paniculitis? Septal paniculitis. Paniculitis itself is referring to the subcutaneous fat looks like. Look at this. Paniculitis is the inflammation of the panniculus, that is the subcutaneous fat. Okay, fine. So where were we here? So there are so many types of paniculitis, and in that, if there is septal paniculitis, it is erythema nodosum. Okay, subcutaneous fat. Do not forget here there will be painful nodules. Painful it is nodules and red, right? So erythema nodosum. You can understand the name. Now, what exactly is happening here? There are immune complexes. Standard stuff that you will read. There are immune complexes. They are deposited in the walls of the blood vessels, and it can be chronic or acute. Okay, now what will you see in these people? Indurated, very tender, erythematous, oval, sometimes acriform, deep-seated nodules which evolve by changing color like a bruise from red to violaceous to yellow before subsiding. Okay, so they keep changing color from red to yellow, looks like. Okay, and they appear like erythema or bruise. They feel like a nodule. They look like a bruise, but they feel like a nodule. Okay, this is interesting. They appear like erythema or a bruise, but they feel like a nodule. They look red like a bruise, but they actually, when you touch, it will look like a nodule. So better felt, okay, that you should understand. They will not ulcerate. That is so good of them, right? They never ulcerate. And they will heal without scarring spontaneously, okay. This is their morphology. Now, where and all does it happen? Usually it is bilaterally symmetric. It will be on the shin of this, shin means tibia, right? And knees, arms also it can happen. And these are painful. That is the only problem we see here, right? It's painful. It's indurated. What do you mean by indurated? Indurated means hardened. Okay, it's hard. And violaceous nodules. What do you mean by violaceous? Violet colored. Okay. Violet colored nodules over shin and lower legs. And what will be the constitutional symptoms? They'll have fever, malaise, arthralgia of ankle. They will have, that's what we said. Fever, malaise, arthralgia. These are the constitutional symptoms. Okay. So you understood how it is, right? What are we learning today? We are learning erythema nodosum. Very good. Where and all you will see? Bacterial infections, streptococcal, viral, fungal. Very good. Tuberculosis, and then sarcoidosis, some drugs also like sulfonylureas, etc. Right? Sulfonamide, sulfonylureas. Okay. Anyway, so you have to rule out what the cause. First, you have to find out the cause. Okay. First, you have to find out that it is this EN, right? So you can do biopsy. Biopsy, when you do, you will get to know that there is septal paniculitis. Okay. And then you will do all these tests to find out what the cause is. Okay. Azotiter for streptococcus, etc. All this you will do. Okay, you'll have to find out what the cause is, right? For that, you will do the investigations. Then what will you do? What are the differential diagnoses they are saying for erythema nodosum? That will be a nodular vasculitis. Okay. Yes, how will you treat erythema nodosum? Now that you have done all the investigations, you will first try to find the cause. And once the cause you have found out, you will treat the cause, right? Then supportive care, bed rest. So tell that guy to take rest. So nice, right? He will feel very happy, hopefully. NSAIDs for pain. Potassium iodide may help. They're talking a lot about potassium iodide, so please pay attention to this potassium iodide. It looks like a simple treatment. So the spontaneous resolution can occur, but it will leave some marks, okay. So we have put that on top. Anyway, so what will you tell this guy? To do bed rest, leg elevation, NSAID for the pain, etc. You may try steroids, systemic steroids. It really doesn't, it's not required. All this potassium iodide, dapsone, hydroxychloroquine you can try, but really they are saying you don't need anything much. Okay, that's what they are saying. If you treat the cause, it's supposed to be good enough. So in this video, you have looked at what? Erythema nodosum. Bye bye.